Thank you everyone for joining us today for this virtual training of self-measured blood pressure monitoring. Today we will be going over how to train patients to take a blood pressure at home. The purpose of this training is not to teach your staff how to take a blood pressure, which we are certain that your clinical staff already knows how to do, but to remind you of some best practices of how to teach a patient to take their own blood pressure at home in addition to the blood pressure monitoring program. So I'm Danielle Nugent. I'm a practice transformation specialist here at Quality Insights. I have with me Cindy Biederman, also a practice transformation specialist at Quality Insights and also a nurse. Today, Cindy will be acting as the clinical staff person that will be training the patient. Myself, I will be acting as the patient today on how to take a blood pressure at home. So Cindy, if you would, please start going through the materials that you wish to share with everyone today.
Sure, thanks, Danielle. As you said, our objectives today are to review everything in our Quality Insights self-measured blood pressure monitoring resource package, the documents, and of course the monitors. And as you also said, to review best practices for teaching patients. So let's jump in, but before we do, I want to ask you to please make sure that you complete both the pre-training survey and the post-training survey. You can see you should have some paper copies that look like this, or you can complete these electronically by linking through SurveyMonkey as shown here. It's a pretty quick survey. It's the same one for pre and post. We just ask that you indicate which one it is, and that everyone attending this training today would kindly complete the surveys. It's not a test of what you know. It's more a test of, are we being effective and actually meeting your needs? So thank you very much for helping us out by completing the surveys. As we said, you should have received your blood pressure monitors. They probably look something like this. And they all should have an instruction manual, but in case you had to refer to it, you can link to it over there. And also if you have questions about, is this device validated? Of course, you want your patients to use a validated device. Our Omron manual or devices, excuse me, are validated, but the list tends to change with time. So if you get questions about it or you're just wondering, you can go to this website down here at the bottom, validatebp.org, and check. We have 3 documents that are for practices in our resource package, and we will go through them all quickly. The first is the overview. It contains just the an overview of things that we'll be talking about today, the documents for you, the documents for patients. I do want to point out 2 things. The first is a place for you to make sure that your practice protocol is consistent, or that you've identified how and when you want your patients to record and bring back their measurements when you want them to return to the office, or whatever it is that is your protocol. And you'll be writing that in on one of the patient documents. And the second one is indicated by this bottom arrow, is a link to a Quality Insights patient video that helps the patients, reviews how to take their measurement properly, which is the same thing that you're going to be teaching them today, but it's quite a bit for a patient to remember. And so a lot of times they want to have access to that video. It's on YouTube, it's free, it's about 4 minutes long. You might want to have it playing in your waiting area or make it available through your portal. But I would encourage you to take a look at it and make it available to your patients. We are also giving you this practice log, which gives you an opportunity to record who you are giving these monitors to and making sure that they report back as according to your protocol. This is strictly optional. If you have a different way of documenting it, that's fine. We just provide this for your convenience. Finally, we have this teach back and return demonstration competency checklist. And we all know that teach back is the most effective and evidence-based way to make sure that our patients really grasp what we are trying to teach them. In this case, the proper way to take their blood pressure. But it's not always easy to implement and take time for the teach back process. So this document is intended to give you a nice framework for doing that. And it has some places for you to check off if the patient has demonstrated the skill, and maybe if they need additional review, you can also check that off. So today, I'm going to be teaching Danielle as our practice patient, and I would encourage you to keep this document handy, and actually you can assess her her competency as we go along. So we would be ready now to jump in. Danielle, are you ready to practice, be the practice patient, put your patient hat on?
Absolutely.
All right, so here we go. Hi, Danielle. I'm Cindy. I'm your nurse today, and Dr. Smith asked me to come in and talk to you about taking your blood pressure at home. And I'm wondering what questions you might have about that.
Cindy, so why is this important to Dr. Smith? Why do I need to do this?
That's a really good question, Danielle. It is important for Dr. Smith, and even more important to you, because we know from all the medical studies that people who take their blood pressure at home actually are more likely to get their blood pressure under control. We know that you come in here sometimes and you've been busy rushing around through your day. And so maybe when you come in, you might be a little nervous, you might just be kind of rushed. And when we take your blood pressure, it might not be as accurate as it could be. But people who take their blood pressure at home, when they can do it, you know, in their own home, in a quiet, comfortable place, and do it over time, it's a much more accurate reflection of what your blood pressure really is. And that helps you and Dr. Smith put together the right treatment plan for you. Does that make sense? I'm glad to answer your questions.
Yeah, do you think this will take a lot of time? I'm a little concerned about not having enough time to do all of this.
Again, a good question. It will take a little time to get used to as you learn the process, but it won't take a lot of time out of your day once you get comfortable with how to do this. And we'll go through all those things today, when and where to take your blood pressure. We're going to give you a chance to practice. And it will get easier, but it will probably take you 5 to 10 minutes in the morning, and again 5 to 10 minutes in the evening.
Okay.
Great. So one other thing I want to point out to you is over here where I've written down when Dr. Smith wants you to bring back your blood pressure readings and how he wants you to report them. So he wants you to bring back the paper log when you come back in a month. So that's
okay.
written down here in case you forget. And also I want to point this out here that says to call us or to seek medical attention if you get a reading that's outside of a certain range. So if it were to be low under this reading here or high, and you were to confirm that, then we would want you to call us.
Okay.
Okay, and now we're going to be going through everything today step by step, Danielle. But if when you get home you want to review, we do have this link to this video here. It's on YouTube, it's free and it's short, and you can always go there and watch that to help you remember.
I like video instruction. It tends to be easier than paper.
I agree. All right, questions on this document? Okay, well, you can always ask us your questions. So the second paper I have for you today is this one that says tips for taking your own blood pressure readings. It has a lot of the things that we're going to be talking about. You can read that at home. But what I really want to point out is the flip side, the back, because this is a blood pressure log, and you can see it has a date for a space for the date, what your blood pressure actually is. And you can bring this paper back when you come back next time. So you want to keep this handy with a pen or pencil every time you sit down and take your blood pressure.
Okay.
Okay, so then I want to just show you this one. This is an infographic from the American Heart Association, and it does go through how to take your blood pressure step by step. Keep this handy as we're going through this, and feel free to refer to it when you practice, because you can see we have Mr. BP sitting in the chair, and all around him are all the things we're going to talk about today. And so this is a really good reminder of all the steps for taking your blood pressure, because then they all are really important to get a really accurate reading, which of course is what you want. Also down here at the bottom, you can see there's a table for checking your blood pressure level when you get your reading. And you'll be able to look at it and see what category it falls into, normal, elevated, and so on. And it has this reminder of when to seek care, just like we had written on the other piece of paper. It would be really important for you to know when you needed to call. Okay, so you're going to keep Mr. BP here handy while we go through this. Questions before we jump in?
No.
Okay. All right, so first thing I want to do is just go over your monitor, which you should have right there. You have the monitor piece, good, and the cuff, just like at the office. And then the cuff has this piece of tubing that has a little plug at the end that goes right into the side of your monitor. Just like that, exactly, very good. So on the monitor itself, you have a start and stop button, and you also have a space for all the numbers, just like when we take your blood pressure here. The top button, or the top number, is the systolic, and the bottom number is the diastolic, and you'll see both of those come up. And then you'll also see a third number that says pulse. That is your pulse rate, and that's kind of interesting, but Dr. Smith says you don't have to write that down. You don't have to do anything with that number right now. Does that make sense?
Yeah.
Okay.
So I need to know the top number and the bottom number, but not so the top number and the middle number, not the bottom number?
Exactly. You don't have to worry about that bottom number that says pulse. It's okay if you do write it down, but that's not what we're thinking about to focus on right now. Okay? And inside the box, you also should have an instruction manual, and you can look at all that at home. Okay? All right. So now we're going to talk about when you're going to take your blood pressure. So you mentioned being a little concerned about time. So that's good for you to kind of think about carving out time in the morning and then again in the evening. And one thing that's really important, Danielle, is it needs to be a quiet time. So if your kids are running around and the household is in full swing, you probably want to work around that and find a better time than that. So you want to do it in the morning. And you want to be able to do this. You don't want to have smoked or exercised or had your coffee or had any alcohol within 30 minutes of taking this blood pressure measurement. So my question for you is, when is a nice quiet time for you in the morning?
It has to be a time when either the kids are at school or asleep. Actually, probably after I drop them off in the morning. But I can't have coffee first, so I'd have to skip coffee, so it might have to be when I first get up before the kids are up.
You're really thinking it through. So that if you need the coffee to get the kids off to school, maybe the thing to do is to take your blood pressure before you take them to school. So it's quiet, maybe before they get up and running around. Does that work for you?
Yeah, that's better. If you want quiet, that's the only way you're getting it.
Okay, well, you do need quiet. So maybe you can sit down while it's still quiet and take your reading. And then after that, you can take you can drink your coffee. You will also want to not take that blood pressure medicine until after you've done your reading. So maybe you take your blood pressure, drink your coffee, take your medicine, and then let those kids get up and get moving. Does that sound like that works for you in the morning?
Yeah, we could try it.
Okay, so you'll take 2 measurements in the morning, one and then another one a minute later. All right, so you've got your one in the morning. How about in the evening? Again, you need a quiet time. What works for you?
When the kids are asleep.
Okay, so when the kids are asleep, you're going to sit down and take your blood pressure then too. Okay. Any other thoughts about the when?
Just that quiet is not easy to achieve in my house, but I can try.
I understand. Quiet is tough, but it's important to get a really accurate reading. Okay, so you've got the when, and now let's talk about the where you're going to take it. So you want to have a space where you can put the monitor like on a table or a desk, and you also will want to rest your arm on a surface like that, the arm that you're taking the blood pressure in. And you'll need a nice chair, a desk chair, kitchen chair works well, so you can have your back supported and your 2 feet flat on the floor. So some people like their kitchen, some people have a desk somewhere, or what works for you?
I have a good kitchen table, and actually I have a question. Why can't I have my coffee? How does that affect my reading? Why is that important?
That is a good question. Well, caffeine can kind of get your heart pumping a little bit, and it can really throw your reading off. As you know, we also said exercise, so you wouldn't want to take a jog and then come right in and take your blood pressure. And even having a full bladder can affect your blood pressure reading. So you want to kind of get as accurate a reading as you can. Make sense?
Oh, okay. Yeah.
Okay. So how about that where? You said your kitchen? You're going to use your kitchen?
Mm-hmm. My kitchen table.
Okay. All right, perfect. So you'll have your monitor and your log, and you're sitting just like the man in the picture with your back straight and your 2 feet flat on the floor. We do not want you to cross your legs, because that's another thing that can really throw off your reading. So we want you to be sitting the right way. Okay. You got your when, you got your where. Now we're going to get to the real thing and practice putting on the cuff. So just like in the office, you're going to put it on your arm. Now, Danielle, are you right-handed or left-handed?
Right-handed.
Okay, so you're going to use your right hand and put the monitor on your left arm. Now, I see you're wearing a nice thin blouse today. So you wouldn't want to put this monitor on like over a bulky sweater or a sweatshirt or your bathrobe. Your bare arm is always best. So we're going to just undo the Velcro, and you're going to slip the monitor on. So this little tube is coming out just above your elbow. So we're going to slip it on your arm. And then you got to cinch up that Velcro.
So this way?
Well, that's upside down. Remember, we want to try and get the tube right over where your elbow bends.
Oh, so this way.
Ah, now you've got it. Okay, now try and get a nice snug wrap with the Velcro. And this takes a little practice, so don't be afraid to practice a little bit. Okay, now you're going to check and see if you have it snug enough. So you're going to see if you can get 2 fingers between the cuff and your arm, and it should be pretty snug. Okay, yeah. That looks really good. Okay, so great. Now's the point where you get to take advantage of that quiet time. You're in your chair, you're sitting right, and you've got your cuff on. Now you're going to take 5 minutes to just sit in your chair and rest. You don't want to be scrolling on your phone or, looking at anything that's going to get your heart rate up. You don't even really want to have an active conversation with anybody. Just 5 minutes, do your deep breathing, take that time for yourself. And again, that's to make sure that we get a nice, accurate reading. So, okay.
Okay.
You think you can find that 5 minutes?
I can try.
Okay. Some people like to set the timer on their phone or something so they know when it's been 5 minutes. Okay, so now you've had your 5 minutes rest. Now we're going to get to the actual blood pressure measurement. So you've got your monitor, and you're going to press the button that says start. So press that, and the cuff is, you got your arm rested on the table with your palm up, right? And your cuff is going to inflate just like it does in the office. Is it inflating? I can't tell on this screen.
Yeah, it's inflating.
Perfect. All right. You let me know when it stops. You'll know because it will deflate at that point.
Okay.
Okay. Do you see the numbers on the screen?
They're still going down.
They're still going down. Okay.
They stopped.
Okay, perfect. And so can you look at that systolic or top number and tell me what that is?
99.
99. Perfect. And then the bottom number, the diastolic, what is that?
69.
69. Okay, that's a good blood pressure reading, Danielle. All right, so you would write that down. Okay, but you can just practice it right now. So you've gotten one reading, but remember, how many times are you supposed to take it in the morning?
Twice.
Exactly. So you did your first reading, and you're going to sit there again, but this time only for 1 minute. So you get 1 more minute of quiet time to yourself. And then after that time goes by, same thing. You'll press your button, the cuff will inflate and then deflate. You'll get your systolic and your diastolic, and you'll write them down. And then guess what?
Okay.
You're done with that part anyway. So now you have
how do I know if it's a good number or a bad number? What if it's a really high number?
Okay, that's a great question. That's when you're going to go back to your handout. Remember that table at the bottom? It's yellow, green, yellow, orange, and red. So let's do that now. Your top number was 99. Can you look at the table and find what category it falls in?
Green.
It's green, less than 120. So that is normal. Perfect. So your bottom number was 69. So go all the way over to the right that says diastolic, the lower number. And can you tell me what level that falls into?
Green.
Green. Again, that's normal. That's a great blood pressure reading. So boom, you're done for the morning. Then in the evening. What
if my first reading is in that bright red category?
Okay, great question. If your first reading is in that bright red category, you're going to, before you get too worried about it, you're going to sit down and again, take some deep breaths and take a rest time and retake your blood pressure. Sometimes things are just weird. And if it were still to be bright red, remember we told you when Dr. Smith wants you, what he wants you to do if you get an out of range reading, which is to call us. If it's off.
So I have to go to that other handout and see what number he said I should call at.
Right. Or you can also look on here. There's another reminder at the bottom of your table for when you should seek medical attention. And the first thing to do if it's office hours is definitely to call us.
Okay.
Okay. So you can do that in the morning, and then in the evening you'll go through that same process of sitting down and putting on the cuff and relaxing for 5 minutes and getting a measurement, waiting again, and then getting another measurement, logging everything and checking your level. Okay. Do you have any questions so far? You feeling pretty confident about being able to do this?
It's a lot to remember. I'm worried that I'm not going to do it right.
It does seem like a lot to remember at first, and that's why we are giving you this nice little handout, because you can use that as you go along for reminders. So that's what we're going to do now. We're going to give you a chance to practice, and you keep that little handout right by your side and go ahead and look at it as you go along. And I'm going to ask you to go through the whole process just like you would. Let's say it's in the morning, and you're gonna go through this whole process now. So go ahead and feel free to look at the little man and talk me through it and show me as well. Okay?
Okay.
All right.
So I gotta start by taking my blood pressure in the morning, and I can't have coffee.
Not before you take your blood pressure, right?
And I have to take it twice. And I have to be seated when I do it at my kitchen table.
You can use your kitchen table, right?
And then
So
I put on.
Right. Let's say you're sitting down at your kitchen table. Go ahead and tell me how you're sitting and how you're going to put on the cuff.
So my back has to be straight, and my feet, something with my feet. They can't be crossed.
Right, flat on the floor, exactly.
And then I put the cuff on, and this part has to go this way.
Exactly, right above where your elbow bends.
And then this might take some practice, but then I make sure that it's tight.
Mm-hmm.
And then I press the button?
Almost. You have to, this is your time to enjoy the quiet. Do you remember that?
The rest. I'm just not used to it. So I have to sit here for 5 minutes quietly. And then I press the button.
And then you press the button, right. So let's say you press the button and the cuff inflated and deflated. Now what comes next?
I have to write down the numbers.
Write down the numbers, right.
And I check on the thingy to see if they're good numbers or bad numbers.
Very good. Are you done yet?
No, I have to do it again.
Exactly. So what do you do before you take it, the reading again?
I sit.
You get another minute of quiet. That's right.
And then I hit the button again and check the readings and make sure that it's not super high.
And what would you do if it was above the numbers that we wrote down?
Call the provider's office.
Exactly. All right. Well, I think you've got this, Danielle. Great job. But you know, you can keep the handouts, take them with you. You can watch the video. And of course, we're here if you have any questions or run into any problems. You feel pretty confident about doing this today?
More than when I started.
Okay. Well, I think you're doing great. So any other questions that I can answer for you?
I have to do this again at night, right? I'm doing it for.
Exactly. The same process again at night.
Okay. Yeah, I think I'm good. The handouts will help, and I think I'm going to like that video.
Great. Well, you call us if you have any questions or problems or concerns, okay?
All right. Thank you.
All right. Thank you. All right. So that is the end of our demonstration. Danielle, you want to take it from here?
Sure, Cindy. Thank you so much for that. We want to thank everyone for participating today. If you have any questions, you are always welcome to reach out to whichever practice transformation specialist currently works with your practice, and or to reach out to myself, Danielle, or to Cindy, and we are always happy to follow up with you. If you need more resources for patients, if you have any questions about the training, or would like a live training, again, please reach out to your practice transformation specialist. Thanks so much, everyone, for participating today. That concludes our training.
Thank you.